15th week of pregnancy. Can you believe you're already here? According to the lunar calendar, you are at the end of the 4th month. According to our normal calendar, which we use on a daily basis, you are at the beginning of the 4th month. I have a lot to tell you, especially about your baby. So if you want to know everything that is happening to you, with your body, with your symptoms, all the formation of your baby, how it is evolving, feeding tips, and a special tip for the week. So stay with me and I'll tell you. Hello, I am Monica Romero. I am very happy to have you here with me. Thank you. I feel extremely honored that you let me participate in this special moment of your life. What a privilege, and congratulations on your 15th week of pregnancy. And let's talk about your body. Did you know that your uterus is already rising? It can already be felt about 8 centimeters below your navel to your feet. And your doctor will start measuring your uterine height. In fact, it is this measurement that matters to see the growth of the baby. It's not the size of your belly, it's not how much weight you've put on, it's nothing like that. Uterine height that the doctor knows how to measure with a tape measure will take from the bone, the pelvis, and even the bottom of the uterus, right? Up to the top of the uterus, he will be able to see if your baby's growth is suitable for this week and the entire consultation for Christmas. You can be sure the tape measure will be over there. And now tell me here in the comments, are you already feeling any discomfort to sleep? Especially if you have the habit of sleeping on your stomach, you may start to experience this discomfort. And that's why I tell you again to start sleeping on your left side, with your left side supported down. And you can now put a pillow under your belly to bring even more comfort to you. This position, in addition to relieving AIs, relieving reflux, it also helps your circulation, helps your kidney work better, so you will have less swelling and are making better circulation, which will also reflect on the well-being of your baby. If you say, Monica, but I can't, I lie on the left side, wake up on the right side, no problem, okay? Right? What you have to do is make an effort to stay on your left side whenever you are awake or lying on a couch. But I understand that not always us. Can you keep the same position all night long? Maybe your belly isn't very big, but maybe if you look down, you can't even see your feet anymore. Are you already like this? What is already starting to change? Your center of balance and also your body starting to do that famous paw walk characteristic of pregnant women. If you are not yet in this position, calm down, your time will come. And speaking of standing, a curiosity for you, did you know that? The foot of the pregnant woman in the first pregnancy can increase by a number and does not return. Look here to testify. I used to wear 38, now I wear 39. It's a little bit of respect. Let's agree. But it's normal. It also happened to my mother. It went from 37 to 38. It also happened to my sister, and it happens to many women. The advantage is if it happens in the first pregnancy, then it doesn't happen anymore, okay? But it's normal to increase from half to a number due to the pregnancy. Because you don't know exactly, but you already know that something happens that may appear to you, if it hasn't appeared yet, is increased salivation, increased blood flow. We have many more vessels, we have our blood flowing much faster, and all this can cause blocked ears, more pronounced salivation, more constipated nose, including bleeding. And how do we deal with all this? We don't have much to do with our ears covered. To escape to the nose, what helps is to moisten the environment and saliva. I'm going to leave a link here for you to a video that I'm talking about, but some women get to have this almost unbearable symptom of having to stick with a towel, spitting, because on top of everything, the saliva tastes like an umbrella handle. It tastes metallic, bitter, very bad, and it really doesn't have it. It ends up not having much to do. What ends up helping a lot is the lemon, but I will leave a link explaining better for you. If it is your case, I will talk. About your baby, this thing doesn't stop growing. As I pass it to you, I go crazy as I pass it to you from head to butt, okay? The legs are not considered in this measure. Your baby is between 10 and 11 centimeters, about the size of the palm of your hand. That's too much. His weight is between 50 and 70 g. It depends on how far you are in your pregnancy, whether it is the beginning of the 15th week or the end, or also genetic factors. Environmental doctors, if you are eating right, all this will influence. But those who smoke will have smaller babies, for example. And they weren't supposed to be smoking. You can't. No, not even those Vipe, nothing can't. Okay, there are two things I want to highlight this week. The first is that he already begins to sob, which would be a preparatory movement for when he is breathing. As he is immersed in amniotic fluid, he won't be able to breathe like we do. He doesn't have air for him at all. This oxygen exchange is done through the placenta. He doesn't breathe and inhale, but you can see that there is already a movement in the chest of this little baby. If you are going to do an ultrasound, that he is already wormed and is already starting to prepare to mature his entire respiratory system, that he will only debut after birth. And the second thing I didn't see, which I highlight, which I think is great, is that now your little baby is already sensitive to light. If you put a belly flashlight or even a flash, he will try to get away from it. He doesn't test too much, not that it hurts, but he's already starting to run away. And since he already has his movements being voluntary, because all the training comes in, right? The connection between your brain, between your nerves, and between your muscles is already okay. This is a very important week because his bones are hardening. Look how important this information, hardening and your muscles getting a little fuller, more formed, stronger. So many moms will start to feel their baby stirring. You won't feel that hand pushing, that belly moving. No, this is for the end of the pregnancy. But you can already feel soap balls popping inside very lightly. Dad or his partner won't be able to feel it yet if you put your hand on your belly, okay? This is something that only you will be able to feel for now. But you can report, and do not forget to mark in the agenda, which is an important date. I felt Lucas at 17 weeks. In other words, if by chance you haven't felt it yet, rest assured that up to 20 weeks you will feel it. And if you have already felt it, it's very likely that you already have a child, right? Second-time moms tend to feel sooner because they already know. This movement ends up not confusing with gases the same normal movements. Our belly is always in motion even when we don't have a baby, so we end up not worrying much about it. And when we pay attention, it's usually not when he's moving. Having for us to feel it, it's incredible how they are already young to increase their expectations. To the little bones in the baby's inner ear, they are already forming. Soon he will start listening to you, singing, telling stories, already begins to practice a delight, putting his hand on his belly. You know, when we complain that we talk to ourselves, start talking to your baby, you know? But instead of complaining, we set a slightly more maternal tone. She puts it on, said, "Oh, I can't believe I knocked my foot." You say, "Oh, do you believe you also hit your foot?" I'm glad I have you with me to help me through this pain. Already talking to your baby that he will be your company for many, many years to tell many, many stories. Your baby's legs are, as long as his little arms, his head is no longer the largest part of the body. His little body is already reaching the size of the head. Despite the head being more vantage, more chubby, more in length, the little body is already advancing. If you are going to perform an ultrasound for these weeks, since last week it was already possible to kick, I'm going to explain kicking the baby's sex through the fetal tubercle. I'm talking about the kick because the chance of making a mistake is still very high. We can't just trust the tuber, okay? But between 16 and 18 weeks, it is already very, very possible, in fact, completely possible to know the sex of the baby. So if you don't want to know the sex of the baby before the ultrasound, let the doctor know because he or she can tell you that's what most end up wanting or ask you to put in the envelope. If you are going to have a revelation tea, then advise the person who will be performing your ultrasound so there are no mistakes, okay? If by chance the ultrasound you did, the first trimester morphological did it, right? Look, I'm watching. If it has given some alteration, you may be asked to perform the NIPTI, that is born genomics, or an invasive exam that calls amniocentesis. Being invasive is not 11, let's say, a defect of his, okay? Because he ends up being more sensitive to be able to see the risks for some diseases. And these tests can give you, especially amniocentesis, a diagnosis, okay? So, for example, if you suspected Down syndrome to myocentesis, in which you will be able to confirm this test, then it may be that you perform one of these tests. Now, in these weeks, if there was a change in its morphology, NIPT, which is non-invasive, which is with the mother's blood, which has Synac from Hygienomics that I talked about several weeks ago, I will leave the link here for you. In several countries, it is already requested as a practice when you are 10 or 12 weeks pregnant. Here in Brazil, it still doesn't have it. It should have. But here in Brazil, it still doesn't have the habit of being carried out, and the SUS doesn't charge it. We only have this exam carried out in paying privately. And let's go to the nutrition tip, which has everything to do with this moment in your baby. The bones are calcifying, right? They're getting tough, so you need to have a lot of calcium in your body. You already know that you find calcium in milks and derivatives. However, for you to absorb that calcium, you need to be with your vitamin D, okay? How do you get good vitamin D? We can supplement, especially if you live in São Paulo. The sun in São Paulo is not good enough for you to sunbathe. And to have this absorption of vitamin D, then usually have to supplement. Now, if you don't live in a city as polluted as mine, hopefully you have a city that has 11 good climate, very good air for you. You can sunbathe in the morning. You can't have sunscreen, okay? A good region to sunbathe is the belly region, and don't take it at the strongest times. So 10 and 4 in the afternoon, it's good to avoid it. But ask your obstetrician for guidance, and if necessary, supplement vitamin D if our vitamin D20 does not absorb calcium. Without calcium absorption, we will be sending it to our baby, but it is taking away from us what can cause, for example, osteoporosis in the future. And for the tip of the week, I will ask you to pay special attention to urinary infection. It is serious during pregnancy and unfortunately very common. So I'm going to give you here some care you need to take and attention to stay away or have a quick diagnosis and be able to treat urinary tract infection. First of all, drinking a lot of liquid is very important when you go to pee. Peeing tries to empty your bladder as much as possible, and when it comes to cleaning, it is always front to back, never the other way around, and just with little taps is enough. There's no need to rub the paper. It's not like that, so we don't take bacteria that would be near our anus to our urethra. Our urethra is very short, which is why it is easier for us to get this infection when it is before having sex or after or not, and then urinate empties the bladder even if it is just a droplet due to friction. It could have brought bacteria back there into our urinary tract, and when we pee, we send her away fast. So this tip is also very important. A natural and proven tip is cranberry juice. I know it is very expensive here in Brazil, but it is delicious and it really has properties that help treat urinary tract infection. Take serious cases only with medicine. So cranberry juice you pregnant can take? Yes, and it's delicious. There are some capsules too, but super delicious, right? And it's nutritious, full of vitamin C. It's worth it. And remember, if you had a change in the color of your urine, if it's more opaque, pain when urinating, if you are urinating all the time, a small amount you are having burning, itching, see your doctor, okay? And the last tip, totally inspired also about your baby, is feeling the taste of amniotic fluid there because of the taste buds that are already formed. It is for you to vary your diet a lot with healthy foods so that he already starts to know some flavors. All this will help a lot in food introduction. I hope you enjoyed these tips a lot. Thank you for being here with me. Don't forget to let someone like you. For me, this is very important. See you in the next video. Congratulations on week 15.